Cervical artificial discs have been on the market for many years now worldwide, and there are several artificial discs on the US market. I want to talk about my experience with cervical artificial discs and why I choose to use the implant that I use. Throughout my training and in practice, I have used several of the current FDA-approved artificial discs and have found all of them to be satisfactory with excellent patient outcomes. The artificial disc that I have been using for the last couple of years and have had really good success with is the M6C artificial disc. M6 started on the US market a couple of years ago, but it's been used worldwide for much longer than that. The experience worldwide is that 60,000+ artificial discs have been implanted with M6, and 12,000 of those have been implanted for longer than 10 years. The success rates have been very high, and the failure rates of the M6 device have been extremely low. M6 is designed to mimic the natural structure of a disc. So every disc in the human body has an annulus, which is a fibrous tissue that surrounds the disc, and then an inner nucleus, which is more of a spongy material that's a shock absorber. The M6 design has a woven annulus, it's hand woven, and then an inner material that absorbs energy. One principle with the biomechanics of a disc is that as a disc rotates and moves, it begins to resist motion the further away from its center as you get. So as you pull further away with movement, it's going to want to push you back. Just because a disc has motion is good, but if it's motion that doesn't resist movement and all of a sudden hits a hard stop, that's not normal motion. Well, M6 resists the motion the further away from center as you get. And I think that has some clinical significance. A couple of other things that are more minor that I really like about the implant. One is it's forgiving, so it could be placed just off to one side or another, and it clinically probably doesn't make a big difference. And another is it's extremely easy to place. So once we've done our decompression, we've removed the bone spurs, we've taken the disc herniation out or whatever, and we're going to put the implant in, it only takes a few minutes to satisfactorily place the implant and have it be in a good position. It doesn't require a lot of extra instrumentation, and I don't think it adds any additional risk of the surgery. Some of the other implants do. So M6 is the device I use. I've been very happy with it. And again, I've had experience with several of them. They're all good generally. And I think right now, of the discs on the market, M6 is one that I have chosen to use in my practice.